Hello students, and I welcome you to this segment in which I will be discussing a very short and a very interesting topic called secondary amenorrhea. Now this secondary amenorrhea can come to you as a short note in your exams, definitely in your viva and your practicals, but at the same time secondary amenorrhea can be asked even in your theory exam. So in today's class, my motive is basically to give you a concept of secondary amenorrhea. See, whenever amenorrhea comes, usually when I was a student and when amenorrhea used to come, I used to run away from it. Many of you must be doing the same thing, especially with primary amenorrhea, because there's so many syndromes, so many things. But if you apply the funda, it becomes very easy, very interesting, and very easy to remember. So today I'll be taking you through a journey in which I'll be discussing with you the secondary amenorrhea. And as usual, whenever I talk about any topic, I always have a plan in front of you how I'm going to go about and deal with that topic. So I'll take you through the etiology of secondary amenorrhea. Like in all other topics, there is a set pattern in which we will be discussing the topics. So etiology, the pathophysiology, what will you ask in history, how will you examine this patient, what all tests will you order, and what should be the treatment if at all you get to know that this is the cause of secondary amenorrhea. Now just imagine a patient who was already having menses. Because of whatever reasons, her menses stopped. This is not a syndrome in the first place, because had it been, she would have had it right from the beginning. So right now this becomes a little easier, because all those difficult syndromes which was a part of primary amenorrhea is not a part of secondary amenorrhea. But what examiner wants to know, and usually these primary amenorrhea, secondary amenorrhea, from a long time, they followed a chain of a battery of tests in a particular order. When we were discussing primary amenorrhea, which I would be discussing as well, primary amenorrhea, you look on the secondary sexual characteristics, present or absent, and then goes the flow chart. In case of your secondary amenorrhea, you follow a different pattern, and that pattern comes somewhere with the evaluation, when we'll evaluate about it. So just imagine that she was having normal menses before. Suddenly her menses are either erratic, they are delayed, or they are just not coming. So what could it be? It could be a hormonal cause, which is not letting the the estrogen get primed or estrogen to develop, or there is some problem with the endometrium that it's not just developing, or something secondary to the flow of the blood, that it's not properly flowing. So now your funda is that she was having menses before. That means the secondary sexual characteristics and all these things, this is not going to be a part of your evaluation. This is secondary amenorrhea. So she was menstruating before. So now your pattern will go in a different direction. So maybe some upcoming or something in her hormonal profile has changed, her body habitus has changed, her uterus has had some problem, or something wrong with the flow structure of the blood. So let's first take you through what could be the etiology of secondary amenorrhea. So the etiology of secondary amenorrhea is usually, like we say, pregnancy, lactation, menopause. The most common 3 reasons for amenorrhea. The other very important reasons are thyroid hormone dysregulation, PCOS, very important, prolactin hormone up and down as one of the factors. There are people who have secondary post-pill amenorrhea. That means they've been on a long time on pill, and now suddenly they have stopped the pill and they're not having normal menses. Other reasons, in decreasing order frequency, Cushing syndrome is there, other, adrenal insufficiency, and these other not so important and not so common causes. Weight loss, weight gain, dietary habitus change, sudden exercises, excessive exercises, all these are causes of secondary amenorrhea. And now let's go on and discuss about the pathophysiology. So in pathophysiology, usually is the funda of any disease, okay? Pathophysiology, which I've already actually discussed before with you, but pathophysiology basically means the whole disease in a nutshell. So if you know the pathophysiology, you can design the entire answer, the entire, treatment and, history and physical examination and signs and symptoms, if you know the pathophysiology of a particular disease. So in this case, when I'm talking about secondary amenorrhea, we know that something is wrong with the HPO axis. Either some hormone is putting an effect over HPO axis, or there is something wrong with the uterus. That means the uterine lining is not being primed because of whatever reasons. Again, why am I saying hormonal profiles? Because something can go wrong with the ovaries. Alright, otherwise maybe everything is fine, but there is cervical stenosis because of whatever reason. So the outflow tract is getting inhibited from the to give the proper flow of menses as it usually is. So if you know this funda of any disease like HEL, IHCP, acute fatty liver of pregnancy, if you know the pathophysiology, you can design the entire disease across it. So most important at your stage right now is at least to know the pathophysiology of every disease, and that should be on your fingertips. So in this case, in case of secondary amenorrhea, I just told you again what is the pathophysiology. That means something wrong with HPO and the outflow axis. So something can go wrong with the hypothalamus, maybe because of some surgery, because of some trauma. There is hypogonad. See, again, this was a thing which was actually a part of primary amenorrhea, but hypogonadotropic hypogonadism will come every time you're talking about the HPO axis. So something is wrong centrally, something is wrong locally. That means some trauma, some surgery has happened, which has made the ovaries that traumatized or that unhealthy that they're not producing their usual hormones. So premature ovarian failure will also come in this particular setting, which is a very, very important thing, and I did not mention it before. So yes, POF will also come over here. PCOS, again a fault with the ovary. And the other thing is something wrong with the uterus or something wrong with the outflow tract. That funda will always stay. That funda is common between the primary and the secondary amenorrhea. Now we talk about what kind of history will you ask. Obviously, she's talking about her menses. So, menstrual history complete. How were the menses before? How are the menses now? How much is the difference? Earlier they used to come in how many days? Now how much is the gap? Any enticing event, any surgery, any trauma, sudden weight gain, sudden weight loss, acanthosis, hirsutism, truncal fat, adiposity. Thyroid problem like skin changes, brittle nails, frizzy hair. So all these things, if you also ask, that will give you a clue as to whatever thing has happened. So apart from that, of course, yes, how were the menstrues before? What was the cycle like? How much was the flow? And now how much is the flow? So, and yes, very important, whether any kind of contraception was used and how long, if pill was used, how long, which pill exactly, because the progesterone content is very important. If the progesterone content was heavy in the pill and was taken for a long time, it usually causes the atrophy of the endometrium. To be more specific, it causes its own, the changes in which it becomes thinned out. The endometrium thins out, and it then usually grows to itself, and the patient starts menstruating again. So basically you need to counsel it. We'll talk about it when we talk about the treatment. So as far as history is concerned, yes, so you will have to talk about the menstrual cycle. You'll have to talk about her complete obstetric history. How was the birth, whether there was any problem post birth, whether there was excessive blood loss. Why am I saying that? Because I'm talking about Sheehan syndrome. Then again, we'll have to talk about whether excessive DNC, multiple curettage were done, Asherman syndrome. So these things, whether there was a history of cancer, something wrong with the ovary, or cervical stenosis because of whatever reasons. So we should know all these right from the time of history. We should know all these things. Then we'll talk about whether it runs in the family, early menopause, POF, whether it runs in the family. Then we talk about the physical aspect. The physical aspect where you will see whether she's patient, what is the BMI of the patient, whether she's having any thyroid enlargement, whether she's having otherwise any symptoms, coarse skin, very dry skin, scaly, and very, hirsutism is there, or acne is there, or brittle nails are there, or hair loss is there, or alopecia is there. So basically these will give you a hint. Galactorrhea, history of any galactorrhea is there. So you will get to know about a particular aspect when you're doing the physical examination. And then we talk about how to diagnose, the most important and favorite part of the examiners in case of secondary amenorrhea.